Today we will be discussing Brown-Sequard syndrome. In Brown-Sequard syndrome, there is a damage to one side or half of a spinal cord, also called as a hemisection. You guys can see this image. This is a transverse section of a spinal cord. When half of this spinal cord get damaged, it is called as a Brown-Sequard syndrome. It is caused by compression to a spinal cord secondary to tumor such as a glioma or the angioma, multiple sclerosis, myelitis and trauma. The trauma predominantly stabbing injury or a bullet injury which stuck in a spinal cord can lead to a Brown-Sequard syndrome. Due to the loss of half of a spinal cord, the patient will present with variety of neurological abnormality. These neurological abnormality are actually the manifestation of loss of a spinal cord tract. In Brown-Sequard syndrome, there are three tracts which are affected. These tracts include dorsal column tract, which are situated in the dorsal column. The second one is corticospinal tract, which are located in the lateral column. And the third one is spinothalamic tract, which is located adjacent to the corticospinal tract. So when these tracts are affected, it lead to the different neurological abnormality. When the dorsal column tracts are affected, it lead to the ipsilateral loss of vibration and proprioception because it carry ipsilateral fiber. If the corticospinal tracts are affected, it lead to the ipsilateral hemiparesis, and if the spinothalamic tracts are affected, it lead to the contralateral loss of pain and temperature because the pain and temperature fiber decussate at the spine. To learn more about the clinical feature of Brown-Sequard syndrome, just look at this diagram. This diagram clearly represents the neurological abnormality in Brown-Sequard syndrome. In Brown-Sequard, there are three levels of abnormality. The first one is at the level of lesion. At the level of lesion means that the level at which the spinal cord is deformed. At this level, there will be a lower motor neuron sign because the anterior horn are dissected. So there will be a local motor neuron sign such as a flaccid paralysis. Along with that, there will be the loss of all sensation. Both the dorsal column and the spinothalamic tracts are affected, which lead to the loss of all sensory sensation. After this, now come toward the second level of lesion. The second level of lesion means the area below the level of lesion on the ipsilateral side. On the ipsilateral side, there will be the loss of vibration and proprioception along with the ipsilateral upper motor neuron sign. There is a ipsilateral loss of vibration because the dorsal column is affected and it carries the ipsilateral fiber. And there is a ipsilateral lower motor neuron sign because the corticospinal tract is affected, which lead to the upper motor neuron sign. Other than this, there is a third area of lesion. The third area of lesion represent the contralateral loss of pain and temperature. Mean if the right side of a spinal cord is affected, it will lead to the left side of loss of pain and temperature because the pain and temperature fiber are carried in the spinothalamic tract and they are decussate at the level of a spinal cord. In short, in Brown-Sequard syndrome, the weak side represents the side of lesion and the area where there is a complete sensory loss is the level of lesion. So it was all about the Brown-Sequard syndrome. If there is still any question, you guys can ask and stay tuned for more update.